correspondent Nicola Hill joins us now live for more on this. Nicola, good to have you with us. Now, have there been any other trials of this kind anywhere else in the world?
There haven't been trials looking at reinfection so far. This is going to be the first one. The idea of having human challenge trials is actually something that's been going on for a while. They've been doing them into colds, malaria, norovirus, influenza, each time looking at how much of a virus is needed to infect somebody. But this is obviously, as you say, it's a very different one because this is looking at a reinfection. Now, here in the UK, there has already been a trial looking at the infection, the first infection of coronavirus. That's being run by Imperial College in London, and they are working with the Oxford team on this reinfection study as well. And in that one, apparently 3 people so far were infected. They were then quarantined, treated, and they're now let out again, so to speak, and they're recruiting more people to continue that research. We don't know any more details about those 3 because they're not sharing it until the whole trial is finished. But as Professor McShane said there, you know, the importance of this work is to find out exactly how much of the virus is needed to reinfect people, but also how much antibodies you need to have to prevent that. So the people that they're recruiting, they will measure their antibody levels. They at least have had to have the virus over 3 months and maybe 6 months or even 9 months ago, but to have some measurable antibody levels. So they'll measure those and then they'll work out how high your antibody levels are and also your T cells and other immune parts of the immune system and how much that prevents you being reinfected. And the reason they're doing this is because there have been cases of people being reinfected, but not in scientific studied environments. And that's why they're doing this trial, so that they can look at that.
I mean, it does seem like really important research, but it does make me wonder about the ethical implications. I mean, what's been sort of, talk us through, if you can, sorry, Nicola, just what the implications of reinfecting a person with a deadly disease are.
Yeah, you do wonder, don't you? And you also wonder on the people who are willing to volunteer for something like this. But you have to understand that before any trial of this sort is approved, it has to go before the Ethics Committee. This is the UK's government's Ethics Committee, and they will have looked into whether it is ethical to do something like this. And the virus strain that's going to be used, this is the original virus strain, will have been grown in the laboratory in very secure conditions, and everything that's going to be done with these volunteers as at Imperial College is done under very secure monitored conditions. They're going to be in this sort of hotel/hospital suite for 17 days, monitored very carefully. I mean, there's certainly arguments about the ethics of doing something such as infecting or reinfecting people with the coronavirus that causes Covid-19, considering we don't have a cure for it. But these trials have been done in the past for diseases that you don't have cures, such as influenza. And that's why, as Professor McShane says, they're very careful to recruit people who are fit and healthy and have already cleared the virus. So they've recovered from it the first time, and their understanding is that they will recover from it a second time.
Absolutely, some really necessary research. Okay, and Nicola in London, thank you very much for that.